This video will give you a general yet useful information about epilepsy. What is epilepsy? Epilepsy is a chronic disorder that causes unprovoked, recurrent seizures. Epilepsy is the fourth most common neurological disorder and affects people of all ages. Epilepsy may be related to a brain injury or a family tendency. However, often the cause is uncertain. Symptoms of epilepsy. In case of a child, memory gaps, mumbling, no response, sudden falls, frequent stumbling, unusual movements such as head nodding or rapid blinking, frequent complaints that things look, sound, taste, smell or feel funny, sudden, repeated fear or anger. In case of an adult, stare blankly for a few seconds during seizure, twitching arms or legs, loss of consciousness or awareness, psychic symptoms such as fear, anxiety or déjà vu. Important information. Having a single seizure doesn't mean you have epilepsy. At least 2 unprovoked seizures are generally required for an epilepsy diagnosis. Possible causes of epilepsy. Causes of epilepsy vary by age of the person. Some people with no clear cause of epilepsy may have a genetic cause. Genetics is the study of heredity or how different characteristics, traits, are passed from a parent to a child. But what's true for every age is that the cause is unknown for about half of everyone with epilepsy. Possible causes. In case of newborns, brain malformations, low levels of blood sugar, blood calcium, blood magnesium. Children's, under the age of 14, fever, brain tumor and infections. Adults till the age of 35, genetic factors, progressive brain disease, which is rare, head trauma, seniors, strokes, trauma. Frequently asked questions in case of an epilepsy. Question number 1. The age which gets easily affected by epilepsy. Answer. There is no defined age for getting affected by epilepsy. Question number 2. Effect of epilepsy on memory. Answer. Any type of seizure could potentially affect on memory. If an individual has loads of seizure, memory problems might happen more often. Question number 3. Can epilepsy be genetic? Answer. Heredity. Genetic or physical traits we get from our parents. For instance, not every head injury leads to epilepsy. Those who develop epilepsy may be more likely to have a family history of the same. In case where family history of epilepsy is involved, there are more chances for an individual to develop epilepsy as comparative to those who doesn't have genetic tendency of epilepsy. Question number 4. Can this be cured by surgery? Answer. Surgery reduces the number of seizures one may have while limiting the risk of permanent brain damage. If an individual has an epilepsy which can be cured by surgery, not been controlled by medicines, in that case the doctors can use MRI to learn where seizures occur in your brain. The most common surgery is resective surgery. After MRI, the doctor can explain the benefits and risk involved in an individual case. Do's and don'ts in case of epilepsy. Do's: protect the patient from injury. Remove harmful objects from nearby and cushion the patient's head. Remove the individual's eyeglasses, tie or scarf. Turn the person on his forward/her side. Stay with the patient. Don'ts: perform CPR. Offer food or water to the patient. Restrain the person. Do not stand around and watch. Epilepsy isn't contagious. Help the person. Thank you for watching.